So before the main results, then I will paint a picture about like a general background, like why income matters and also why income insecurity poses a threat to health and well-being of the older adults and also other like population as well. So income, as you might have heard of several times, income is one of the social determinants of health across the countries and across the populations. So there are several mechanisms that can explain why income matters for health of older adults and also other generations. So first, it is clear that like a basic needs, which means that income helps us to afford necessities such as healthcare and also education and also food and other etc. like necessities. And there's another aspect that can explain income and health is financial stability. Like, for example, thanks to enough income that we are able to invest in education and also skill development, which can help us to job opportunities in our like a job career trajectories. So income is also related to like a skill development job opportunities, and also it helps us to prepare for future emergencies as well. Another perspective, like a psychological or psychosocial perspectives, is a social cohesion. So there are several ecological studies which demonstrate that if the like for example if the when neighborhood has enough income or increase the level of income, then there could be reduces like a reduction or decreases in crime rates associated with economic desperation. All of which is to say is that income can be related to well-being and also health of our generations across generations by leading to like for example psychologically or materially like those perspectives that highlights the importance of income as a social determinant of health. So if the income really is really important as a social determinant of health, then we can raise the questions or we can extend this kind of concept to life courses, like life course perspectives. What I mean here is that, for example, babies or like a childhood or adolescents, living environments, education, and employment for younger adults, like a young working age populations, all of these are the kind of social determinants of health. Of course, for babies as well, income is parental income. It's also one of the social determinants of health, which means that for usually for the working age population, income really matters because the majority of like a younger and also middle-aged persons, they are working in the labor market, which means the primary source of their income is from the labor market, like for wage as wage earners, which means income is one of the critical and also important determinants of health, particularly for younger and also like middle-aged adults. By contrast, or on the other hand, then we can ask a question, is income really matter for older adults? Like for example, because older adults, the majority of them have already retired from the labor market, which means that they could have another sources, like financial resources that can rely on in order to meet their living demands. So we can there are several studies that can demonstrate income is still determinants of the social determinants of health, but others they argue that income could be there could be another determinants of health other than income that can affect health or well-being of older adults. Still, what I argue here is that income is a still and also important determinant of health because in order for healthy aging, then they are more likely to invest in their a healthy lifestyle, and also as we get older, then there could be an increase in healthcare expenditure, and also there could be increase in long-term care expenditure as well, which means that younger adults and also middle-aged adults, they tend to prepare for their kind of like a post-retirement life as a retirement planning by saving money or by investing in their housing assets or using on other sources in order to prepare for post-retirement life. So if income really matters for as a social determinant of health, then we can also ask a question. So how it look like, in Canada and also for older adults living in Canada? according to the statistics reported by OECD members, like what OECD is one of the membership of the wealthy countries, including Canada, United States, and also other European countries. So according to these statistics, it shows that the poverty rates among Canadian older adults is one of the lowest around the world. Then we can say that, okay, older adults compared to other countries, they are well prepared or they are well positioned to live their life thanks to lower poverty rates. Then we can divide several categories, like what kind of income sources they can rely on for their post-retirement life, not only for wages, but also for other sources as well. So income of older people from employment, self-employment, and also capital and like a public transfers. There are several categories according to income sources. So capital represents 40% of all income sources of older adults in Canada, which is quite different from other countries. For example, in Korea, that where I am from, Korea is still there is highest level of poverty rates like compared to other countries because of lower coverage of pension plan system, which is why many older adults living in Korea, they are still working in the labor market in order to afford their necessities. So here in Korea, work is one of the main income sources for older people, which means they are still working. On the other hand, there are European countries such as Norway or Germany. More than half of their income sources are from public transfers, such as like income subsidies or public pension plan. On the other hand, what is difference like between Canada and also other country is that Canada has higher proportion of capital as a source of income, which is quite different from other European countries like Norway or United Kingdom. Most of their income sources are from like a public transfers, but Canada, 40% of their income is from capital. So what is capital as an income source? That is another question. So capital, they also can be divided into like a subcategories in terms of their use. So for example, some people they have accumulated in their like a retirement accounts as savings. So once they save money and then they are able to spend those money for their living standards in later life. Or another types of capital is investment income. Like for example, people tend to invest in stocks, bonds, or other securities, and then later, like if there is an increase in profits, then they are able to generate income by by relying on investment as well. In terms of housing, like housing capital, there are two types of capital, like as a source of income. So one of the examples here, then we are able to sell assets in order to generate income. Like for example, older adults after retirement, then they can sell real estate they live in or other valuable possessions to generate capital and to fund their retirement. I will explain these kind of examples in the next slides. So selling assets is also one of the sources for income as well as capital. And also home equity. So maybe you might have heard of reverse mortgage that is quite prominent across countries, across provinces, which means in a way that we are able to convert a portion of their home equity into tax-free cash. So we are able to borrow our cash against our owned property. That is the idea of reverse mortgage, and also many countries they are encouraging homeowners to rely on reverse mortgage for their living standards as well, if they have no income as well. And also there is another way, like a home equity, which is like people are able to move out to another place. Like once older adults they become like an empty nester once their kids left their home, so there is no need to live in big place, right? So in order to downsize their homes and also generate their income as well, they are able to move out to another place, which is also called another types of home equity. So selling assets and also home equity, those are the two types of capital, like in terms of housing as a source of income. So in terms of housing assets, like capital as a source of income, then it is rooted. It is originally from the notion of asset-based welfare system. So asset-based welfare system, it's an increasing trend in many countries, not only in United States, like also Canada, and also in other East Asian countries or other European countries. So the rationale for asset-based welfare system is that home ownership really matters. Why? So home ownership can be utilized or can be capitalized on like for several purposes. First, one of the clear purpose, like a usefulness, is that it can provide a buffer against income loss. Like for example, we can prepare for our emergency situations by preparing for by purchasing a home as soon as possible. And then we can rely on those home ownership and also housing assets in our later life as well. And also psychologically, home ownership, it's one of the kind of dream for older and also middle-aged adults in order, like not only for psychological comfort, but also for economic comfort as well, economic prosperity as well. And also another rationale for home ownership is that it can compensate for weak public welfare benefits because some of the countries, for example, some of a few countries in Asian countries, they are not well prepared for kind of public welfare system, like a fully pension system, fully coverage pension system. In order to compensate for weak public welfare benefits, then some countries they are eager to encourage people to have home ownership as soon as possible. Then later life they can sell or they can housing assets borrow cash against their housing property, as I showed you in the previous slides. So that is also one of the rationale for home ownership, like asset-based welfare system. So maybe you might have heard of several kind of home ownership oriented policies. One of the representative examples are first-time home buyers incentives and also home buyers plan that are increasingly dominant in many countries, which is called home ownership oriented policies. Of course, home ownership oriented policy of which main purpose is for economic growth and also individual economic prosperity. But another rationale um, that I have mentioned here, it's another way of kind of compensating for income loss and also buffer against income loss. As a result, there are many countries that have experienced a rapid increase in home ownership rapidly than before. So under this system and also another increasing number of households and also individuals, they are eager to become homeowners, like a home ownership or homeowner societies, or they are eager to enter into home ownership societies as soon as possible by, for example, spending a lot of money and also by investing and also like saving monies as well. But it is not, despite these rationales, it is not necessarily the case that like an asset-based welfare system can successfully operate or working with like a beyond our expectations. Like there are critics or there are arguments from these like scholars that who argues that asset-based welfare system is not working nowadays. I will show the several scenarios why it is not working. First is passing down wealth and assets. So some of the older adults, they are concerned about future housing careers of their children because nowadays, because of housing crisis and also economic crisis, since it's quite hard and also challenging to afford housing, and also it's even hard and challenging to purchase a home housing, like in metropolitan areas particularly, which means that younger kids, even though despite their eagerness to become homeowners, but it is not achievable nowadays. Because of that issue, older adults they want prosperity of their kids. So as a result, they want to inherit or leave housing assets to children rather than selling their housing properties. And also another reasons is that intergenerational transfers. Like, for example, they have expectations in exchange for housing assets, in exchange for inheritance of housing assets. Then they are expecting that, oh, maybe their kids will provide social care or provide material or instrumental support for their economic well-being. So there are intergenerational transfers, so-called intergenerational transfers, which is also increasingly dominant trend nowadays in many countries. Because of that issues, it is not like housing assets is not working successfully than we expected as well. And another examples or another reasons why asset-based welfare system is not working is that housing crisis. Housing crisis, like housing prices has been increased rapidly than wage income increases. So wage increases gradually, but it cannot catch up with the increase in housing prices, which means even after retirement, older adults, they are still paying off principal and also interests on mortgage, which is quite different from our expectations because thanks to what we have argued is that thanks to housing assets, then older adults, they are able to live their life very well and also healthy, like in terms of healthy aging, but which is not true nowadays because they are still paying housing mortgage uh, by spending a lot of money for just for housing, which means post-shelter income decreases because of that housing home ownership as well. And also another reason is that it is from administrative perspective, it is quite hard to rely on like a reverse mortgage or other systems for which is called here limited eligibility for home equity and also reverse mortgage. Even though the governments they are trying to increase like housing like reverse mortgage or home equity, it is not easily implemented because there could be appraisal fee and legal fee or administrative fee. So it is hard to figure out how it is going to work if I apply for if I submit an application for to reverse mortgage or home equity. So older adults they're reluctant to accept kind of fluctuations or like unpredictability in housing market. So they don't want to use or they don't want to rely on home equity or reverse mortgage. It is also another reason as well. More importantly, there is an increasing trend of trade-off relationship between home ownership and also pension. As I told you in the previous slides here, one of the rationale for housing asset-based welfare system is it can compensate for the weak public welfare benefits. So in some countries, many countries, like some governments, they are pushing for home ownership oriented policy with expectations about increasing home ownership rates. But as a result, then they tend to decrease old age pension. They tend to have cutback on old age pension because they have assumption that maybe most of older adults they will be homeowners in a later life. So there is no need to invest or there is no need to increase old age pension because thanks to home ownership, thanks to home ownership rates among older adults. But which is not true because what happens to lower income persons who have no housing assets? If old age pension decreases, then they could be in jeopardy, like in terms of living standards. Without income, without pension, and also without housing assets, their living standards could decrease, and also which in turn deteriorates or poses a threat to well-being and also health of older adults as well. Based on such rationale or based on such arguments, then we can raise several questions. First, is income security or income insecurity constitute a substantial concern among the age populations? Because some of the scholars, they have argued that income is no longer significant thanks to housing assets. So I will investigate, I will show you next slides as well in terms of income security. And also, is there any association between housing insecurity or housing security and also housing assets, and also mortality risks among older adults. Then there could be some cases, for example, housing asset rich but income poor. Even though they have housing assets beyond their more than they thought, but if it's the case there is a lower income, then what happened? What kinds of problems they can experience as well? That is the third question. And there's the last one, more importantly, is that such issues can be examined, can be observed in the context of Canada. So according to many studies, there are some arguments that there is a decrease or there is no socioeconomic inequalities in Canada thanks to universal health coverage. That is also what I have expected since I came to Canada for a PhD journey. But some arguments on other arguments, they also arguing that even though a small difference, but there also it is clear that there is a socioeconomic inequalities in mortality or health disparities even in the context of Canada because of the other social factors or because of other socioeconomic problems as well. That's what motivates me to identify how income and also how housing assets they are related to mortality or health disparities among older adults living in Canada. So my main analysis or my main research is the focus is on older adults in Canada, which means I use two data sets in that are available in Statistics Canada, so RDC data center. So one of them is NHS 2011. So NHS is one type of census every 5 years. So 2011 NHS National Household Survey, it is implemented. That includes income, other socioeconomic factors as well. So income and also value, housing value, etc. as well. Another data source that I have used is CVSD, Vital Statistics Database, which has information, for example, how many people are dead or died over years, and also year of death, and also cause of death. One of the advantages for two data set is that they have personal, individual level anonymous identifier, which means I can link together two kind of data sets in order to identify, for example, some of the persons they could survive over follow-up period until 2011, but some of the persons they could they might die until in 2011. So I can identify how long they have survived or what year they died because of housing issues or because of income insecurity as well. So this data set has 881 and 220 older adults, which represent 15 to 20% of older adults. So which is why that many people, they use National Household Survey or Census Canada because they are one of the nationally representative data sets in order to understand socioeconomic and also demographic issues of older adults. So first I estimated how income and also housing assets are related to mortality risks. So first the finding here is that compared to highest income non-poor, there is higher risk of mortality among the lowest income person, which I named it income poor persons. So income poor persons, they are more likely to die, 1.2 times more likely to die compared to highest income, which means that income still matters, for understanding mortality inequalities among older adults in the context of Canada. And there's another second finding that I have found here is that there is also mortality inequalities explained by housing assets. So compared to the highest housing asset value persons, there are no asset, which is I named them asset poor. Asset poor persons, they are also more likely to die compared to their counterparts, who is highest asset value, 1.346 times more likely to die, which means that all of which is to say, income is also matter, like one of the determinants that can explain mortality risks among older adults in Canada. And also at the same time, housing assets, they are also one of the social determinants of health that can explain mortality risks among older adults living in Canada. Then I wonder, another question came to my mind is that what if some of the persons they have housing assets but no income? Or there could be another case that there could be non homeowners who are like a renters. There could be older renters, but they could have enough income. So there could be several cases or several scenarios that I was able to like simulate. For example, one of the ideal case here is that older adults they have housing assets and also income together as a source of their financial like, well-being. But another two cases that I mentioned here is that asset poor but income non-poor persons. What I mean here is that they are not homeowners, but in some cases they have enough income in order to support their life. On the other hand, this third case here is that like a so-called asset rich but income poor, which means that they have been expected to become homeowners, which means they were able to become homeowners by saving money and also by investing some their cash, and also results in their post-retirement life, then they are able to become a homeowner. But unfortunately, and at the same time, they have no income, which means they are asset rich or asset non-poor and also but income poor as well. The last two case is that asset poor and also income poor for several reasons. Like I will explain it later. So I was able to categorize or make a typology or types of older adults according to assets and also according to income together. So by using census data, like NHS data sets, I was able to find out how many persons they are at risk of income insecurity and also housing insecurity as well. So according to the data sets like analysis, 73.3% of older adults they have housing assets and also they have income. They are not income poor persons. So luckily, like unfortunately, the most of the older adults they are able to keep their living standards in a good way. But unfortunately, approximately 5% of older adults here they have housing assets but they have no income, which means they are experiencing income insecurity. And also at the same time, still, even despite the asset-based welfare system, and also despite an increasing trend of home ownership in older adults in Canada, but there are still older adults who have no housing, like who are renters, still renters, but fortunately they have enough income, which it can help to keep their living standards. But the worst scenario here is that 5% of older adults, they're in jeopardy. I mean, in terms of housing and also in terms of insecurity, they have a lack of financial resources. They have lack of financial resources to support their life. So I also was interested in how disparities in mortality that can be explained by housing assets and also income together. So compared to asset non-poor and also income non-poor persons, who are the ideal case according to my definition. So ideal case like a non-poor and also asset non-poor and also income non-poor persons compared to those counterparts, then first group, they have housing asset, but they have no income. They also have higher risk of mortality, despite the presence of housing assets, but income still matters for their life. And there's another case here as well. They have no housing assets, but they have income, which means like housing non-poor, but housing housing poor, housing asset poor, but non-income poor, they also have higher risk of mortality compared to ideal case here, asset non-poor and also income non-poor. So we can say that despite the presence of income, a lack of housing assets poses a threat to well-being and also health. So the last case here, last group here is asset poor and also income poor, which I named them double poor. So double poor has the highest risk of mortality compared to other counterparts here, which means income and also house when they are absent together, like the absence of income and also housing assets, they could poses the highest threat to well-being and also health or mortality risks among older adults. So based on these findings, then we can summarize our main findings, like based on this analysis. One of them is the presence of substantial socioeconomic inequalities in mortality, even in Canada. So what I explained in the previous slides is that Canada has relatively lower socioeconomic inequalities in mortality according to previous articles, which might be true compared to other countries such as United States, but unfortunately still socioeconomic inequality still matters in the context of Canada and also in the context of older adults. What it is interesting here is that there are also another arguments or another assumption is that there could be decreased mortality inequalities among older adults because there are already premature deaths that occurred in younger ages. So as people get older, there could be higher probability of survival effects among older adults because premature death already occurred before they get older, which means that there could be decreased mortality inequalities among older adults. That is one of the assumptions according to several articles. But still, in this paper, we found that socioeconomic inequalities in mortality still prominent and also still silent issue among older adults, even in the context of Canada. Then income and also housing assets as a second finding, they are related to mortality risks independently. What it means independently is that housing assets does not change the link between income and mortality, which is against the notion of asset-based welfare system. So asset-based welfare system, scholars argue that housing assets in a later life, they can compensate for income loss for well-being and also living standards of older adults, but which was not examined or which is not significant in this study because housing assets and income, they're independently associated with mortality risks, but housing assets does not significantly change the link between income and mortality. So it's one of the findings that is not consistent with the notion of welfare, like asset-based welfare system. Then the another finding is that asset non-poor but income poor and also asset poor but income non-poor, those groups of which persons one of either of asset or income is absent, those groups are also have higher risk of mortality. But more importantly, one of the finding is that also both asset poor and also income poor, which I named them like a double poor, they are the most vulnerable to mortality risks. So one of the explanations or like suggestions relating to this finding is that those double poor groups, they have less opportunity to build housing assets over their life course due to their reasons, like personal reasons. And also another reason might be they are not able to fully benefit from private or pension plans due to eligibility or reduction in pension coverage. That is the main summary of the findings according to this analysis by using Census 2011 NHS data sets and also linkage data sets, including CVSD, Vital Statistics Database. So what kind of conclusion or main points that we can derive or we can conclude based on these findings? the main argument here is that we should revisit the ideas or like a rationale of asset-based welfare system. So many people argue that housing matters. Housing, of course, housing matters, but some people argue that because housing matters, then we need to encourage people, or particularly older people, to purchase a house as soon as possible before their retirement. Of course, it could be possible, but according to our findings, that we cannot ignore the importance of income on the belief that housing assets will offset income insufficiency. Housing matters, but also at the same time, income still matters as a social determinant of health for older adults living in Canada because compared to other countries, Canada is very kind of well situated, like a well positioned in terms of lower poverty rates, as I showed you the previous like a figure. But as we see this trend here, unfortunately, the poverty rates, income poverty rates among older adults, it's according to this trend, it's gradually increases, even though there's a slight decrease. But anyway, in general, there is a gradual increase in income poverty, which means that income security or income insecurity is a socioeconomic concern, and also it's also can be a risk factor for well-being and also health of older adults. So we are still should highlight the importance of income, even though housing also matters. And also the second main point, in terms of policy implications, is that the government, despite home ownership oriented policy, like for example, home buyers plan or first home buyers incentives, those kind of policies could be important for some of the persons, or at the same time, there should be a balance with the pension schemes, like income support schemes, such as sustainable pension schemes and also flexible tenure mobility to ensure that they are able to capitalize on their housing assets, like for example, home equity or selling housing assets. The government should encourage older adults or some of the people to sell their housing assets or to rely on reverse mortgage as well. So there should be balance between housing policies and also income policies together. Last but not least, there also could be older people who are not homeowners, but also at the same time they have no income. So for older non-homeowners who have a lack of income, securing affordable tenancy and also subsidy for housing stability should also be sought. So which means that housing stability still matters for older adults, but also at the same time there could be many of older adults who have no income, so they should support housing and also they also should provide income support together. Even though I presented these findings in the context of Canada, so my finding here presented today is based on one of my articles here that is published recently last winter. So even though this is in the context of the Canada, but I also examined this kind of assumption, tested this hypothesis in the context of Korea. Korea is also one of the countries that has highlighted and also that is encouraged a asset-based welfare system, but which is not successfully working. Which means that across countries, globally, income security is also one of the critical and also socio-economic issues that are related to well-being and also health disparities of older adults. So that is the end of my PowerPoint and also presentations. And also thank you for listening. Thank you.
Excellent. Thank you very much, Gum-Ryeong. Just going to get the clap action going. There we go. Thanks. That was fantastic. Really appreciate the presentation. Of course, I was fairly familiar with the work, but love to see the amazing graphics that you've added, and you just explained it in an incredibly accessible way. So thanks again for that. So we're now ready to take questions or have discussion. If you can raise your hand and then remember to unmute yourself when we call on you. If you prefer, you can put the question in the in the chat. Lindsay will watch the chat, and I will watch the icons here as much as I can because they're on. Oh, wait a second. I think I got them all on one page now. Okay, good. Any questions for Gum-Ryeong?
We do have one from the chat.
Oh, great.
Sorry, from the Q&A.
Yep.
So it's a question. This is a question from Robbie. He's wondering, on slide 5, what is occupational transfers and why do none of Canada's employer-based pension plans qualify?
I have no idea how the occupational transfers is working in Canada. I think I need to get some clarification. Maybe Jim, you have the expertise regarding that issue. But in some countries, like in the case of Korea, for example, when was working in the Korea, it's quite mandatory pay certain percentage of my income for the pension for my post-retirement life. It's as a public pension scheme or also private pension scheme. So I think it's called like occupational transfers, which means that government and also workplace, they impose kind of try to get some taxes from the employees in order to maintain their pension scheme. That's what from my understanding. So do you have anything to add, Jim?
Well, it sounds like the equivalent to the Canada Pension Plan. Right. So it's for earned income, it's a mandatory deduction. As you say, it's capped, but it's part of what goes into retirement incomes. Robbie might want to follow up on that, actually.
Yeah, it was just on that slide 5, it really jumped out to me that Canada had 0 in occupational transfers and every other country had some. Given that it's what we see in the European countries with high levels of public benefits, my assumption is that CPP goes into the public side of things. And it just left me wondering what is in the occupational transfers category. I would have expected it to be private pension plans. But Canada has private pension plans, and so why isn't it there?
Yes.
Anyway, it's OECD data, so
yes,
I'm sure we could dig in and find out more about that.
Right.
I have other questions later, but I'm going to shut my mouth for now and see if anyone else has things to ask.
Yeah, I mean, as ever with an organization like the OECD, they have their own definitional idiosyncrasies, and they might not make a lot of sense in other instances, or you just don't meet the threshold for a particular to qualify as a particular category. Other questions for Gum-Ryeong?
I may raise my hand. I have a question. You're talking about sort of the groups of scholars or who are arguing in favor of asset-based, the asset-based sort of welfare schemes. Is that sort of ideological? Can you tell us a little bit about who it is that's trying to argue that this should be sufficient, or this sort of scheme would be the best?
It depends on the context of countries, but originally, from my understanding, the asset-based welfare system, it's originally started from East Asian countries, which means that because in East Asian countries, they are not fully prepared for a health aging or a public pension system. Because of the lower coverage system, then the government tries to kind of turn to a home ownership plan. For first purpose is economic growth of the at the national level, and also at the same time they can encourage older adults to rely on housing assets to compensate for income loss, even though it starts from the it started from the perspective of East Asian countries, but nowadays that you have seen the many news medias that in United States and also America and also European countries, there is an increasing trend of home ownership rates, but also at the same time there is austerity in terms of a public spending, right? So there are still nowadays many people and other scholars, they argue that despite its origin in East Asian countries, it is still examined or observed in the North America and also European countries and also even particularly the aftermath of economic crisis, because after economic crisis, austerity usually happens. But other than government trying to turn to home ownership oriented policies, as an excuse, I have no idea. But anyway, in order to encourage like home ownership as well as to compensate for income loss.
Thank you.
Yeah, I mean, I think it's more or less explicit in different places. I think it's much more implicit. It's much more implicit in Canada, but I mean, the notion of home ownership is something that is aspirational in a lot of countries. So even the UK, which has a very, very large proportion of housing delivered by the social nonprofit and public system, like 22% or so. Even in the UK, I mean, the mythology around home ownership is actually still very, very strong. There's a very famous book written by Peter Saunders called A Nation of Homeowners. And the idea being that it's sort of an identity. And I think in a lot of ways, it's actually gives additional benefits of citizenship. But that's a whole other discussion, right? It sort of enfranchises people, and renters are sort of dismissed as not being citizens in lots of ways. Okay, moving on. Saud.
Yes, thank you for the presentation. On one of your final slides, I think, slide 16, right at the very end, you presented a few recommendations for a revised asset welfare system. And you mentioned that the poverty rate in Canada for seniors is increasing, or that Korea also isn't doing great in terms of implementing a revised asset welfare system. I was wondering if there were any examples of OECD countries that were doing a good job at this, like a success case to follow.
I mean, it's important. I mean, first of all, thanks for your question. So first of all, there could be two examples that I can explain. One of them is Nordic countries. I mean, Nordic countries, it's well prepared for welfare state in terms of welfare states. So like they are quite open to kind of welfare systems, not only for public pension, but also for employment benefits or kind of that system. It's still successfully working in Nordic countries. So in terms of income support, like public spending, like public benefits, Nordic countries could be one of the example representative cases. In terms of housing sector, maybe like Austria or some of the countries, they have it's not income support, but in some of the countries such as Austria and Germany, they have higher proportion of social housing stock, which means that compared to other countries like the United States or Canada, those European countries, they have a social housing stock, like a social housing stock, they are relatively higher, which opens to a broad segment of the populations. It's not just targets on the lower income persons or unemployed persons. It's open and also universal to everyone, which can be kind of one of the examples in terms of housing supports. I mean, which I argue, like not from these findings, but as I study more and more, is that maybe in addition to home ownership policies, I think it should be kind of two-track systems which can motivate home ownership, but also at the same time guarantee or ensure equal housing, like a right to all of the people by providing social housing, like a stocks for the broad segment of the population. That's one of the examples. Another second types of examples that I can present, like I can, suggest as well.
Okay. Other questions? Oh, Zainab. Please go ahead. Unmute. You can unmute yourself. Thank you.
Can you hear me? Thanks.
Yeah, thanks.
So my question actually, I was just curious because I was very interested about the association with mortality. Like I thought that was very, very interesting. So how did you define premature death? I guess like I'm kind of wondering like what age you were kind of thinking.
So thank you. So this study is not about premature death. So usually premature death is defined by the death which occurred before maybe older, like age limits, usually like a 65. So premature death usually defined for like a younger and middle-aged adults. But here, because I focused on the older adults, it's not premature death. It's just just overall mortality risks among older adults. But the reason why I mentioned in premature death for this presentation is that if there is a premature death in middle and also younger aged persons, then there could be a decrease in mortality risks among older adults as a result of increase in premature death that are already happened before they get older. So which is why I mentioned like a premature death in these slides.
Yeah, so I think actually the one of the other important points to come out of that, Gum-Ryeong, is that your results probably underestimate the differences, because there may be people who died before the age of 65 who
Right.
aren't actually in your study. Had they lived beyond 65, they
Mhm.
would have been in the census from the index year. And those people are far more likely to have been lower socioeconomic status in the first place, right? So it actually probably underestimates the effects. So so whatever, the 1.2 odds ratio or so that you have is probably underestimated, if anything.
Yes, that's an important point, because one of the limitations for this paper is that because the NHS data set, it only includes information from older adults living in community, which means that, like, for example, older adults living in long-term care settings or other institutional settings, they are not included in these data sets, which is another like a limitation that can underestimate the link between like a socioeconomic factors and also mortality. So I'm planning to use like a different census data set now, So like how could it could be related to over time, even including like older adults living in long-term care settings or other institutional settings. That is another my research plan as well, relating to these limitations.
Great. Any other questions? We'll come back to you, Robbie. Oh, yep, there we go. Yeah, so I was going to come back to you, Robbie, if I didn't see any other hands. So,
couple of things. Let's start with the meatiest of them. Your conclusion was more or less that, or one of them was that the housing-based policy does not abate mortality risk. When I looked at the set of numbers, I was struggling to run a comparison in an apples to apples way that gave me that result. I mean, if you compare no asset, double poor people to income poor, but with housing, they're better off. The harder comparison to make, perhaps the better one, is housing poor, income non-poor to income poor, housing non-poor. But even that, in because of the way you've run your groups, and in that scenario, it looked like the ones who were housed but income poor actually did better. But because of the way you run your groups, it's tricky to see, because your income non-poor group is most heavily the people who are just above the poverty line, 50 to 100% of median income. That's the majority of your income non-poor group. So even though their mortality risk is higher, they're kind of skewed to that end of the distribution, versus everyone who is a homeowner. Sorry, that was my other question. Is your home ownership was showed by tenure of housing, how long they'd owned that house.
Yes.
Did you
I
have
no information?
Sorry?
No, go ahead.
It was was it a binary yes, no, owns a house, does not own a house? Was that your categorization of?
So first of all, there are two variables that I define, like operationalize these measures. So one of them is housing tenure, as you have mentioned, whether you have your own, like you live in owned occupied housing or not. Then like there are private renters or like a subsidized renters, but I mean I define them as like a renters, like a housing poor. But in terms of housing assets, one of the questions that I used is the respondents that are required to respond or asked to respond to value, self-estimated value of housing. Then I was able to categorize like assets, like several quantiles or like several groups based on the value of housing assets they have self-estimated. So there are two variables, housing tenure and also housing value, dwelling value that they have self-estimated.
But the results you presented to us were simply based on housing homeowner versus non-homeowner. Is that correct?
Yes.
Okay.
Right.
And I mean, I was thinking about the question of if you are trying to look at this perspective and ask what percentage are still paying mortgages in their retirement. Did you control by age?
Yes, I did.
I
Yeah,
was gonna say,
control by it. Yes.
Your age profiles are probably going to look different between those groups. So, I guess the question there is convince me. I'm looking at your data. I'm not convinced that this asset-based welfare approach, that this go buy a home approach, is not protective. To me, it looks like, yeah, maybe there is some protection there in home ownership. I'm wrong. Tell me why I'm wrong.
You kind of not problems, but the like a rationale or like a problematic that rationale of the asset-based welfare system, right?
Yeah, what I'm saying is, when I look at the results that you present, it looks to me like home ownership is protective. That this group is still trailing homeowners and people who are non-poor and homeowners, but people who are income poor but homeowners seem to be better off than comparable people who are double poor or income poor and income non-poor but non-owners. So to me, I'm looking at that and going, hey, maybe this policy works. Maybe having a home actually helps. That's what I saw in it. And tell me if I'm wrong and why I'm wrong.
Maybe that's another future plan as well, because I'm also like as a result of this kind of data set and also analysis, I also was wondering like how people have think about like their the meaning of their home ownership and also the value of home ownership they have in their mindset. I mean, for the older adults. So another future plan is like a future research for regarding that issue is that there could be a different data sets that can track the kind of changes in income and also changes in housing assets. Like which I mean is that even this data set, it's cross-sectional data sets, but another data set longitudinally, I can identify like what kind of income sources, like for example, did they really rely on housing assets in order to generate like income in order to compensate for income loss or kind of that? So I'm eager to kind of this study like by tracking or changes in income and also changes in housing assets and also the meaning of housing and also income for older adults. So maybe I need some more time to convince you in terms of the like a rationale of the housing asset-based welfare system.
Okay, thanks so much for that, Gum-Ryeong. I'm going to call it there, and thank everybody for attending. We're now at time, and I'm really glad for such an excellent presentation, great discussion afterwards, and the recording for the presentation will be sent out to everyone who registered in the coming days, and it'll also be available on our YouTube channel. And just a quick reminder to the students in Dr. Singh's course, please reconvene after the presentation on the separate class discussion Zoom link that Dr. Singh provided. Okay, and thank you very much for coming, everybody, and we'll see you hopefully at the next seminar series for the McMaster Institute for Health Equity. And thanks again for the co-sponsorship from the Center for Advanced Research on Mental Health and Society. We really appreciate it. Take care, and thank you, Gum-Ryeong. Great presentation. Bye-bye.
Yeah.
Bye.
Bye.